So this is cutting edge aesthetics here. What we see in a lot of people are brows that over time become a little more horizontal, and we see lids getting heavy. Okay, and what the knee-jerk reaction of a lot of physicians is to do a brow lift. When you look more closely, what you're going to see here is that our patients sometimes lose volume, they lose fat in the area above the brow. And what happens as that skin becomes looser, because it doesn't have a cushion of fat supporting it, the skin falls and the brow gets heavier and the lid gets heavier. So instead of doing a surgical procedure like a brow lift, very often we'd use a dermal filler like Restylane or Juvederm, or even a patient's own body fat, fill in the area above the brow, and then all of a sudden we'll see this beautiful brow lift, which is long lasting. So we're giving the brow its support back, and the support for the brow is in the forehead. So this is a great example, and if you come from the side, you'll see a what we call a step off, actually a loss of volume as we go from the front of the forehead to the side. You can actually see where that's a little bit hollow. So that's cutting edge aesthetics. That's taking someone and non-surgically correcting something and creating these subtle changes, which are really nice. And unfortunately, if people would have a brow lift here, the patient would have a funny looking result. So we always look for non or minimally invasive solutions before we look for something surgical. At times, surgical thing is really what's indicated, but oftentimes we can work around it. And this is not an age-related thing. We see this in people that animate a lot, that spend their life like this. We see it in people that don't have a lot of body fat, and we can see it at age 30, 40, 50. I mean, you see it at all ages. It's not technically an age-related phenomena. It's really a movement-related phenomena. So just thought it was a cool tidbit.